would say is the most hazardous thing that you can ever buy and ever introduce to your child. If you want your child to, if you personally feel that I must buy something bad for my child, buy your child a bottle feed. That's what, because feeding bottle is the worst enemy for the child. See why this feeding bottle culture usually happens, you have to understand, because majority of the mothers are working mothers now. At 3 months of time, their maternity leave gets over, they want to top up with some amount of milk. I'm not against top up milk. I say you top up milk, you express your milk and you give top up milk. That is fine. But there are ways. See, there is never an easy way out. So most of them resort to for a feeding bottle, telling that my baby drinks fast. With a cup or a spoon or with a tumbler or even a sipper, it is laborious. I cannot take so much of time. No, because the hazards of bottle feeding is for your baby, not now, as forever. See, if you see, if the moment you put a feeding bottle, there is something called as a nipple confusion, where there are so many companies which have come to tell that this nipple mimics as like the mother's milk. Nothing ever matches never to a breast feeding. So what happens is that there's something called as nipple confusion, where the baby keeps the mouth, the milk flows. So the baby wants the milk. So the baby keeps drinking that milk. That's what happens, and they don't have an urge to suck at all. So over a period of time, instead of sucking, the milk flows down and the baby will use the bottle as a nipple as a pacifier. Similarly, they'll use the mother's nipple also as a pacifier, and they will stop sucking and automatically the breast flow stops. That is one part. The other thing is that, as we all know, India has very clean water everywhere, and everywhere there is infection. I'm just sarcastic. So obviously, you wash with the same water, obviously your nipple gets infected. They say I have bought the best brand sterilizer. Ideally, if you look into sterilization conditions, your plastic and rubber will melt. That is what an ideal sterilizer should do. So you can never sterilize a feeding bottle nipple. So that has lots of bacteria which sits then and there, and so much of microbacteria seeding, your child gets unwanted infections like a diarrhea, lots of aspiration, because there's something called as a jet, where your baby drinks milk fast, it goes into your lungs, they can have aspirations, and they can have lots of teeth caries, decayed tooth over a period of time. Not this. See, over a period of time, your baby will not be willing to explore any kind of solids. They would just want to suck at the feeding bottle, and they don't want to take any solids as such. That is what would be their prime aim at all. And at 1 year and 2 years, we see mothers who come crying to us telling, my child is not eating anything, I'm not able to stop bottle feeding. If you want to undergo all these headaches, be a guest to buy a feeding bottle, or else better not buy one.